Diagnostic Ultrasound's patented Bladderscan Bvi6100 is a unique handheld tool that helps you, the healthcare professional, provide the highest quality care for your patients. Thanks to Bladderscan technology, catheterization solely to determine bladder volume is now obsolete. The Bladderscan provides a sound indication for catheter use, enabling caregivers to reduce unnecessary catheterization and urinary tract infection. The Bladderscan Bvi6100 uses ultrasound waves to delineate the boundary between the bladder wall and the urine. This boundary is detectable because ultrasound waves reflect differently from the tissue and the fluid. Based on these reflections, the Bvi6100 creates an accurate three-dimensional measurement of bladder volume. To enhance and expand the capabilities of the Bladderscan Bvi6100, Diagnostic Ultrasound created ScanPoint, an online service that gives users the option to view ultrasound images from exams and save and print exam results for patient records and reimbursement purposes. The Bladderscan is advanced technology that's easy to use. You do not need to be a trained sonographer to achieve accurate results. Simply apply a Sontec gel pad, aim the scan head, and press the scan button. A microprocessor in the instrument performs all the calculations necessary and displays the patient's bladder volume on a screen. In part 1 of this video, you'll learn to use the Bladderscan Bvi6100 to measure a patient's bladder volume. In part 2, you'll learn how to save and print exam results using ScanPoint, Diagnostic Ultrasound's innovative online service. When you unpack your new Bladderscan Bvi6100 from its shipping box, you'll need to charge the battery before using it for patient exams. Place the scanning unit in its cradle, making sure the cradle is plugged in and the green power light is on. Fully charging the battery may take up to 6 hours. Diagnostic Ultrasound recommends that you keep your scanning unit in its cradle when not in use, so the battery is always sufficiently charged for patient exams. When out of its cradle and not in use, the scanning unit will turn off automatically after 20 minutes to conserve battery power. Press any button to turn the scanning unit back on. After you have charged and turned on the scanning unit, you're ready to measure a patient's bladder volume. Make sure your patient is comfortably situated for the scan. Patients may be scanned either supine or sitting in a slightly reclined position. The highest degree of accuracy will be achieved when the patient is lying in a supine position. New operators should first scan patients with moderately full bladders. This will make aiming easier and build staff skills more rapidly. Peel back the foil lid of the individual Sontec packaging to expose the gel pad. Next, palpate the patient's symphysis pubis, or pubic bone, and place the gel pad midline on the patient's abdomen, approximately 1.5 inches or 4 centimeters above the symphysis pubis. Smooth the gel pad to make sure that no air bubbles are trapped between the gel and the skin. Air bubbles may interfere with ultrasound transmission and reflection. Clean the scan head by gently wiping a cleaning pad dampened in isopropyl alcohol or disinfectant over the rounded end of the scanning unit. Note that if the patient is a female who has not had a hysterectomy, you should first use the gender button to select the female option. The female option allows the scanning unit to exclude the uterus, which may resemble the bladder ultrasonically. For all other patients, use the default setting. It is now time to scan the patient. Place the scan head on the gel pad, pointing it slightly downward toward the expected location of the bladder. If the patient has a significant amount of adipose in the abdominal region, apply light pressure while scanning. Press and release the scan button, located on the underside of the scanning unit's hand grip. A scanning symbol appears in the upper right corner of the LCD screen. Be sure to hold the instrument steady until the scan is complete. Moving or tilting the scanning unit may compromise accuracy of measurement. Scanning takes approximately 2.5 seconds. When the scan is finished, the Bladderscan beeps and displays the measured bladder volume in milliliters on the screen. If aiming arrows appear on the LCD screen below the bladder volume measurement, then the scanning unit was not aimed properly and the displayed bladder volume measurement is inaccurate. A greater than symbol also appears before the bladder volume measurement, indicating that it underestimates the true bladder volume. Re-aim the scanning unit and repeat the scan. The aiming arrows indicate the location of the bladder relative to the scan head, toward which you should adjust your aim. When the scanning unit is aimed properly, no aiming arrows will appear. To help you aim the scanning unit correctly, visualize ultrasound waves being projected out of the scan head toward the patient's body. If the aiming arrow points to the left, then you should aim the instrument so that it projects ultrasound waves further to the left. The following examples illustrate how the aiming arrows work to help you achieve the highest degree of accuracy. In this example, no aiming arrows appear. The scanning unit was aimed properly, and the displayed bladder volume measurement is accurate. An aiming arrow appears in this example. This means the bladder was not fully in view of the scanning unit, and the displayed measurement may underestimate the patient's bladder volume. Re-aim the scan head in the direction indicated by the arrow and rescan the patient. Here, the aiming arrow points left, indicating that the bladder is located to the left of the scanning unit. In this example, no aiming arrows appear, but a greater than symbol still precedes the bladder volume measurement. This indicates that the bladder was too large to be fully contained within the scanning unit's field of vision, and the true bladder volume may be greater. In such cases, re-aiming the scan head and rescanning won't help. However, at these high volumes, measurements are still clinically useful, even though they underestimate the true bladder volume. When you are satisfied that the scanning unit was properly aimed and the measurement is accurate, note the bladder volume displayed on the screen. You may want to chart this measurement since the Bvi6100 will not retain it after you begin a new scan. If you do not replace the unit in its cradle, after 20 minutes, the instrument will turn off to conserve battery power and your exam data will be lost. As a Bladderscan Bvi6100 operator, you have the option of saving and printing exam results using ScanPoint, Diagnostic Ultrasound's new online service. ScanPoint allows you to create an easily accessible history of a patient's bladder volume, view high-quality ultrasound images from the exam, and create detailed printouts of exam results. For more information about using ScanPoint to save and print exam results, watch Part 2 of this video or consult the Bladderscan Bvi6100 Operator's Manual. But first, let's review the process for measuring a patient's bladder volume with the Bladderscan Bvi6100. If the scanning unit is in sleep mode, turn it on by pressing any button, then check the battery icon to make sure the scanning unit's battery is charged. Next, use the gender button to select or deselect the female option. Remember to select the female option only for women who have not undergone a hysterectomy. Apply a Sontac gel pad to the patient's abdomen. Place the scan head on the gel pad, aiming it slightly downward toward the bladder. Press the scan button and hold the scanning unit steady until the scan is complete. If the scanning unit was not properly aimed, aiming arrows appear below the bladder volume measurement, indicating that you should re-aim the scan head and rescan the patient. Repeat the scan as necessary until you're satisfied that your aim is correct and the displayed measurement is accurate. When you are satisfied that you have achieved an accurate result, note the measurement displayed on the screen. The Bvi6100 will not retain this data after you begin a new exam. You may wish to write the measurement down or use ScanPoint, Diagnostic Ultrasound's online service, to save and print the exam result. The bladder scan is a valuable tool in many healthcare settings, from urology and private practice to acute and extended care. Caregivers today use the bladder scan to evaluate the need to catheterize, discontinue Foley catheter use, measure post-void residual bladder volume, monitor a patient's hydration status and urinary output, diagnose urinary retention, verify that a Foley catheter is draining properly, evaluate and care for patients who suffer from incontinence, monitor residual urine during a voiding trial, or assess bladder volume to establish a voiding schedule. For more information about the applications of the bladder scan, consult one of Diagnostic Ultrasound's clinical manuals. There is one for acute care, one for primary care, and one for extended care. In these easy-to-use manuals, written by noted medical professionals, you'll find detailed protocols and guidelines for bladder scan use. Catheter use should always be indicated by a measurement from the bladder scan, ensuring that it's medically necessary to perform the catheterization. Whether in private practice, acute care, or extended care, The cost-effective, easy-to-use Bladderscan Bvi6100 helps you, the healthcare professional, protect the health, comfort, and dignity of your patients. In this part of the Bladderscan Bvi6100 video, you'll learn to use ScanPoint, Diagnostic Ultrasound's online service, to save and print exam results for patient record-keeping and reimbursement. Using ScanPoint, you can easily view quality ultrasound images from any Bvi6100 exam. After you measure the patient's bladder volume, place your scanning unit in the communication cradle. Then go to the ScanPoint website, located at dxuscanpoint.com. Log on to ScanPoint by typing your username and password on the ScanPoint sign-in screen. Then click Sign In. To save your exam result, click Perform Exam on the ScanPoint menu. You must save your exam result before you can print it. On the Perform Exam page, enter the patient and exam information. Then click Submit and wait while the Bladderscan Bvi6100 transmits the exam results to ScanPoint. When the exam results have been saved, ScanPoint displays the message, "Exam received successfully." After a few minutes, the message, "Click here to view your exam results," will appear, indicating that ultrasound images from the exam are available for you to view. Click this message to view and print your exam results. If you do not wish to view your exam results now, you can log back on to view them at a later time. When you log on again, click View Exam Results, then click New Exams. ScanPoint displays a list of all the exams that have not yet been viewed. Click the exam you wish to view. ScanPoint displays exam results in a window that contains the patient and exam information, the bladder volume measurement, and ultrasound images from the exam. To print your exam results, scroll to the bottom of the exam results window. Then click a Print option in the lower left corner. A preview of the printout appears. Click Print this page to print the exam results on your local or network printer. Then click Return to Exam Results to close the print preview window. When you are done viewing and printing the exam, click Close to close the exam results window. All exams you save on ScanPoint are stored conveniently for your future review. After you view a new exam result on ScanPoint, the exam record is saved as a past exam. To view the results of this exam again, go to the ScanPoint menu and click View Exam Results, then click Past Exams. For more information about viewing new and past exams or saving and printing exam results, see your Bladderscan Bvi6100 Operator's Manual or ScanPoint Online Help. To access ScanPoint Online Help, simply click the Help option on any ScanPoint screen. You can also consult the ScanPoint Saving and Printing Quick Reference Card for a brief review of the saving and printing process. Diagnostic Ultrasound's ScanPoint enhances and expands the capabilities of the Bladderscan Bvi6100 by providing detailed ultrasound images online for easy record keeping and review. The Bladderscan is the standard of care for bladder volume determination. Easy to use, non-invasive, cost-effective, and accurate. With multiple handsets and online saving and printing of exam results, Diagnostic Ultrasound's Bladderscan Bvi6100 provides enhanced accuracy and utility, along with all the other features caregivers have come to rely upon from the Bladderscan family of products. Please contact your Diagnostic Ultrasound representative if you have any questions. We're pleased to have you as our customer. Let's work together to protect patient health, comfort, and dignity across the healthcare continuum.